All right, I think we'll go ahead and get started. So I'll go ahead and start introducing myself. I'm Joshua Baber. I'm the retiree administrator, direct bill administrator. So um, I will often handle retirees' benefits post-retirement. So if any changes to your plans, your enrollments and things will go through me. Um, and all the premiums and payments and things like that are going through me. I recognize a lot of the names here, so I know we've um, talked some in the past. Coleman is a retirement officer. He's on here with me. He can answer questions that you send through the chat as we go along. That way I can kind of just present the information. If you have questions, you can click on the chat, ask Coleman. He can follow up with you there. Then at the end, we both can kind of follow up with everyone uh, with uh, with those questions that were raised or any additional ones that you might have. All right, so as you know, we're going into the 2025-26 benefits open enrollment. So these are changes that are happening effective July 1st through June 30th, so on our fiscal year. Uh, and like normal, this is your annual opportunity to personalize your benefits. So times when you can make changes um, without any qualifying events during open enrollment for the next fiscal year. So this started on April 28th, is open enrollment. We extended it to 3 weeks this year. So April 28th through May 16th will be the last day. As I said, this is your once a year opportunity to make changes. This is to change your health. So this is for retirees under the age 65, or if you're on a UK plan. So if you're a working retiree over 65 on a UK plan, you can make changes to that health. If you are a Medicare individual on our Medicare Advantage plan, you cannot make changes to your health insurance at this open enrollment. You'll have a separate one with Medicare, which is October 15th through December 7th. Everyone, though, is eligible to make changes to their dental and vision insurance. So this is your part of the year where you can make changes to those dental and vision, even if you're on Medicare. So there are still some voluntary benefits. Retirees may continue with any additional benefits that you already had at retirement. There are just a few that retirees can add, such as legal services, group home and auto insurance, and pet insurance. And we'll kind of go over those towards the end of the PowerPoint. So we'll start with some access to care. So these are different UK healthcare locations. So we are working to increase primary care as far as UK healthcare. One opened last May, adult and pediatric primary care in Hamburg. There's a Frankfurt clinic that just opened March 31st of this year, an adult primary care there. Extending one into the Madison clinic that's scheduled to open this winter, 2025 at the end of the year, and then another Fayette clinic scheduled to open in the next year, 2026. And so there are additional options besides just the traditional UK healthcare clinics. There's Team Blue Clinic at Kentucky Clinic South. That one would be located out near our South Creek campus where our benefits office is actually, just past Turfland. There's a UK healthcare acute care clinic out Turfland, which is out Harrodsburg Road, and then Fountain Court, which is out Manowar area towards Hamburg. You can still see the employee urgent care at our University Health Service on campus, and then retirees or anybody on a plan is eligible to do the live health online, and so that's doing a virtual meeting with your provider. And then there's always the Anthem 24/7 nurse line as well. Okay, so choosing a health plan. Like I said earlier, these are plans for under 65, or if you're a working retiree that is eligible for the UK plans. Before we get started on the actual plans, we'll just kind of reiterate on some definitions. So Your premium, that is your set amount that you will pay every month. Your deductible, so this is going to be the amount you will pay out of pocket before the insurance starts paying for some services. So you'll have to meet that deductible out of pocket before your insurance technically kicks in. So copay, that's going to be a flat fee you pay for healthcare service. And then a co-insurance is a percentage of the overall cost you pay for healthcare service. We do get questions often about co-insurance. That's a popular thing, especially with the Medicare plan, but there are some co-insurances with the HMO and PPO as well. That would say, if it was $100, you would pay 10% of that $100 instead of paying a flat fee like a copay would be. I also want to just point out there's a $0 copay for the Live Health Online that I mentioned earlier. And it kind of helps to lay it out in phases as far as deductible coverage and then your max phase. So to start, starting July 1st, your deductible will restart. So you'll pay the out-of-pocket for your initial healthcare cost when the plan year starts until you meet your deductible. So that's going to be your deductible phase. For instance, if it's $100 or $200 deductible, once you see your service, you will pay for that service until it reaches that, and then the insurance will kick in. So you'll go into the coverage phase after reaching that deductible. This is where you would start paying your copays or your co-insurance out of pocket, and that's when the insurance is covering part of that. So you'll just have to cover the copay or co-insurance. And there are out-of-pocket maxes. So once you reach the max, your cost will be $0. Insurance will cover 100%. So those are the three main phases that you would be in when using your insurance. And so we really try to offer employees distinct choices. The plans can differ in three main ways. So you have to consider your monthly premiums. That's amount deducted typically per paycheck. If you're a retiree, often we have you just in the direct bill system, as you might know, pulling from bank accounts. So that'll be the amount deducted each month from that bank account for that premium. Your out-of-pocket costs, so this is going to be the amount paid at time of receiving care. So that could be either trying to reach your deductible out of pocket, your copay, or your co-insurance after you reach the deductible. And as far as provider networks, so if you're on the HMO, that's only UK healthcare providers. So you'll have to see UK healthcare providers, like the ones I mentioned earlier, and the ones that we're expanding into Madison County, the one that we expanded to Frankfort, and trying to expand more in Fayette as well. So the 25-26 plan options, you can decide which health insurance plan's most important to you. There are different advantages or perks to enrolling in each one. So the HMO is going to have lower monthly premiums, lower out-of-pocket costs, but you don't have as more options to choose a provider. The PPO is going to have lower out-of-pocket costs if you are seeing UK healthcare, but you also have more options to choose a provider in the nationwide Anthem network. But the monthly premium is going to be a bit higher for the PPO, considering the larger network that you have access to. And so we definitely understand choosing health plans important. It's important for any family members, dependents on the plans, and just know that we're definitely here to help. So you'll always have access to our websites. We have a specific one for retirees where you can check under 65 plans, the dental, vision options. And if you're on here with Medicare Advantage, we have an option on there to check out Medicare as well. Excuse me. You can always reach us at our customer service line, 859-257-9519. We are option 3. And that's going to take you to our general customer service line. Everybody is knowledgeable about the plans. If it gets very specific, we can transfer to that certain administrator. So, oftentimes it might get transferred to me if it's a specific enrollment question with post-retirement. We have our email, benefits@uky.edu. That's where you can send forms, questions, just anything that you might have a question that you would call about as well. During open enrollment right now, we are also offering individual consultations if you need support beyond initial phone call or the email. You can set that up with us through email or phone call. Just reach out to us. We'll get somebody to set up an in-person virtual meeting, and we can answer more in-depth questions that way. And so this webinar, you can watch a replay of this webinar at our website. And as of right now, we have open houses to meet with HR benefits and other vendors. So these open houses, we will be there as benefits. There's also going to be Anthem, TIAA, Fidelity, the Know Your RX prescription group, MetLife, and dental, different vendors that you'll have as part of your insurance. Now I'll just go over some of the health insurance plans. So we'll start with the HMO. The key benefits with HMO is it's lower monthly premiums, and there's going to be a lower out-of-pocket cost associated with it, such as deductibles, copays, and co-insurance. To consider with the HMO plan, so it is only available within the 10-county Central Kentucky service area. UK Healthcare is your provider network, so you must see UK Healthcare providers and doctors. So something new with the HMO this year is that UK Retail Pharmacies is going to be your exclusive pharmacy provider. That is a change that is happening, and Know Your RX can be very helpful as you have questions if you're changing a pharmacy, especially if it's dealing with a specific drug. They can help go over your provider with those pharmacies. They do offer free mailing for your prescriptions as well. So consider the HMO if you don't need medical care outside of the Central Kentucky area, like the convenience of seeing UK healthcare providers. For example, so there's Steve, good overall health, receives routine services, such as annual physical, flu shot, lives in Lexington, works at the Kentucky Clinic. The convenience for Steve having his providers nearby, his appointments during the day, and low co-payments is a very simple but direct example of someone that would choose the HMO plan. So this graph, I'll leave it on here a second, just kind of so everybody can look over it. Changes to copays or co-insurance. There's not any drastic changes really with these with the HMO, although some things are going up. So these are the main ones. With the specialist office visit, your copay was going from $30 to $35. Routine diagnostic radiology and labs. It was a $0 copay, and this is one that's changing to a co-insurance, so 10% co-insurance. So what that bill is, you would cover 10%, and your insurance will cover 90. Your urgent care copay is changing from $25 to $35. Emergency room visit is a $100 copay, then 20%, changing from 10% last year. And this is waived if you are admitted from that ER visit. An ambulance is going from $75 copay and to a co-insurance, 20% co-insurance of that service. Your inpatient hospital stay is changing from $200 copay to $250. And the hospice and skilled nursing facilities is changing to a 10% co-insurance from a $0 copay. Deductible is new with the HMO plan as well. So as you mentioned, you have to see the UK Healthcare Network. An individual is going to have a $100 deductible. So with your first service, outside of preventative care, like your annual physical, that's preventative. As your first service, you'll meet that $100 before those copays and co-insurance mentioned on the other slide will kick in. So that's an individual single plan. A family plan, that's going to include um, children or a spouse on it, and that's going to be a $200 deductible. So you'll meet the $200 before the insurance kicks in. Your medical out-of-pocket maximum. So this is the maximum that you'll meet before the insurance covers 100% of services. For the individual plan, it's going to be $3,000, and that's out of pocket. Um, and then the family plan is going to be $6,000. So we get a lot of questions about this. It can get a little confusing based on your age service matrix at retirement. So this is our chart we have for monthly premium employees. These are under the age 65, hired before January 1st, 2006, eligible to retire after July 1st, 2007. And so this is our age service matrix. Your retirement officers, when you're retiring, determine this with you, and this is locked in at retirement. So as you go up in age from 60 to 61, it's not going to change in the table. It is locked in with what you have your age and service at retirement. So 15 to 20 years of service is on the far left. And then as you age closer to 65, that price drops. 20 years of service to 25 is in the middle, and 25 years of service or more is on the far right. And we still have on our website the rates from last year that you can compare. Uh, so retirees under the age 65 hired on or after January 2006 are not subject to that age service matrix table like we just shown. You will pay $1,223 a month for your plan. So everybody would be subject to that if you're not on the age service. And if you wish to add a spouse who is under 65 or children, these additional rates will apply. So you can add the children at $672 a month, spouse going up to $1,588 a month, spouse plus children or family is an additional $2,265 a month. And for ones that are on here on Medicare, this does apply if you have a split plan. If you are on Medicare and you have your spouse or children on an under age 65 plan, these would be the rates that you would they would be subject to on your plan. That's the brief overview of the HMO. So we'll start on the PPO network plan, which is a larger Anthem nationwide network. So it gives you more flexibility to see any providers outside of UK healthcare, but always keep in mind your costs are lowest when you see UK healthcare, and this will kind of might make more sense as we go over some of the slides later about seeing UK healthcare as compared to your Anthem network. So considerations, consider it's a higher monthly premium in exchange for lower costs when you receive care and greater network flexibility. So PPO does have higher premiums, but you have a larger network to see providers outside of UK healthcare. And really consider if you or your family need the flexibility to see a different healthcare provider. So that could even be if you already have a specialist or any provider outside of UK healthcare, the PPO is something to consider. A brief example for someone that might have PPO, established relationship with a doctor outside of UK healthcare for a chronic condition, even though they are still located in Lexington and work off campus, doesn't mind paying the higher deductibles or copays with more choices where she might receive care. So as I mentioned, that's pretty much same with your larger Anthem network with the PPO plan. And so here are some changes to copays or coinsurance. We'll kind of look at them in two different parts. As you can see on the two left columns for 25 UK healthcare and 25, 26 UK healthcare. $15, and so this is just seeing UK healthcare, even though you're on the PPO plan. A $15 copay, there's no change there for seeing UK. Urgent care center copay is actually dropping $10 if you're on PPO and you see UK healthcare. No change to the outpatient surgery copay. Um, the emergency room visit is changing from a $100 copay to 10% coinsurance. It's changing to just only 30% coinsurance. Outpatient therapy and inpatient hospital stays, those are not changing with UK healthcare on the PPO plan. It's $20 copay for outpatient and $300 copay for the inpatient. And so the two right columns, these are seeing your Anthem network. So this is seeing anyone outside of UK healthcare that is within the Anthem network. Primary care visit is going up $5 copay from 25 to 30. There are no changes with the urgent care center copay. Outpatient surgery, it is changing from a coinsurance to a copay. So from 20% of that surgery, you will go to paying a flat rate of $500 copay. The ER visit is the same as UK healthcare. It is going from the $100 and 10% coinsurance to a flat, just 30% coinsurance. Outpatient therapy is changing from $30 copay to $40 copay, and your inpatient hospital stay, instead of a coinsurance, it's going to a flat $1,000 copay. So here are your deductibles and out-of-pocket maximums with the PPO plan. So seeing UK healthcare and Anthem, as we mentioned, are different. Your individual plan under UK healthcare is going to be $200. You'll meet that $200 with the UK healthcare network before it would kick in at the UK healthcare. Your individual plan deductible with Anthem is going to be $1,000. So it's something to keep in mind. If you're in the coverage phase with care, you can be in the deductible phase if you network provider. So if you stay within UK healthcare PPO plan, you make one of these two deductibles, you'll go into coverage phase, although it doesn't mean you're out of the deductible phase with that. And that same applies to your out-of-pocket. The out-of-pocket maximums for the PPO at UK healthcare, same as the HMO, $3,000 for $6,000 for a family. At your Anthem network, it's $1,000 for individual and $8,000. So this out-of-pocket maximum is what you'll pay out of pocket until insurance covers 100%. Here's the age service matrix chart again, as I with the HMO. So these are your monthly premiums for employees under age 65, hired before January 1st, 2006, and eligible to retire after July 1st, 2007. And again, this is at your age of retirement. And as I mentioned on our web, we have still have the ones up from last year. Compare of those rate changes. Need to determine which age service you're in. Always reach out to us. We can let you know that. If you're in direct bill, I get this question a lot: is your dental and vision premiums are taken out at once with your health premium? So you're kind of paying in a lump sum for your premiums. If you need to know just what your health is, reach out and we can go over which part of this chart you would fall under. And these are the additional prices for retirees under age 65, hired on or after January 1st, 2006. You would pay $1,291 per month, and you would not be subject to that last chart that I've shown. Here are the additional rates. Again, if you're on Medicare and you have a split plan for a spouse or children, these additional rates would apply to them. So those are the two health insurance plans that we have. I know that can be brief and they're very personalized, and so feel free to ask questions and reach out to us with specific questions, and we're happy to help or set up a benefits consultation about those. So those are the two main ones. We know RHP and EPO are no longer available after July 1st, so switching a plan um, can be intimidating and can change. And so, please feel free to reach out and we can help as much as possible. Then I'll go over some additional benefits. This is going to be things like your dental vision, your work life, um, and then the other MPM benefits that I mentioned at the beginning of the slides. So HR's work life and well-being offerings anytime, and these are to retirees as well. All of this information you can find more through our well-being website through hr.uky.edu. So you have in-person and telehealth appointments with a therapist at no cost. That's a mental health, work-life, and well-being offering. You're still able to get in touch with CapTrust financial advisors. These CapTrust can help support with budgeting, planning in retirement, any kind of student loan forgiveness, saving for college funds, any kind of financial advice that you might want. Um, you can still with nutrition, dietitian, personalized programs, community supported agriculture vouchers, personal resilience such as health coaching, tobacco cessation, and headspace, and physical activity. So you have 3 fitness membership groups, uh, group fitness classes, exercise specialists, steps challenges, and move well rewards. So all of those gym things are through our move well. And you also have access to elder care. So we have elder care specialists that you can meet with, get you in touch with monthly support groups and different educational webinars if you have any kind of elder care responsibilities. So dental and vision insurance, there are no increases to dental and vision insurance rates. There aren't any changes with the coverages. So if you've been on these for the past years, then those are continuing as is. No changes in the premiums and no changes in the coverage. We still have our 2 vendors for dental. That's going to be UK Dental and Delta Dental. We have 2 different options under each of those vendors. And all plans include 2 annual cleanings covered at 100%. Your vision, again, those are not changing. These are 2 plan options from IMED. Both plans include 1 eye exam every 12 months and the purchase of lenses or contacts every 12 months. The differences between those are mainly your insurance, that your allowance towards frames or your payment towards a higher tiered lenses. And again, those are not changing, but if you want to make changes to those, everyone's eligible to make changes to those during open enrollment, even the Medicare retirees. So you're still offered the other insurances through different vendors. So open enrollment is an opportunity to add those. So you have MetLife Legal Services coverage, cost-effective help wills, contracts, family law, and other legal matters, cancer and disease-specific insurance, your universal life insurance guaranteed issue up to $125,000 without answering any medical questions, and this is only if you're enrolled at retirement. So you would have to continue those through retirement. You can't pick those up. And so you can still visit our MPM group to check your eligibility. Those will not be associated with your direct bill that you might have dealt with me in the past. I'll just have your health, dental, and vision. Each of these additional other insurances will have their own kind of direct billing through there. And so that's that's a brief, pretty quick rundown of our health insurance. I hope it's helped answer any questions, shed some light, especially if you're making changes or if you're coming off of the RHP to a PPO. We can definitely, if you have any questions, reach out. We can go over them now. And again, I'm going to leave this slide up right here so we can answer questions now. There's our website. You can reach us always at the 859-257-9519, option 3. That's going to take you to our customer service. Again, we still have open houses throughout the next 2 weeks, and those are going to be, we have some virtual and we have some in different locations on and off campus.
All right, so if anyone would like to unmute and ask a question, there should be an option to raise your hand. We can manually sort of unmute you. We have one here. I'm going to mute you, Judy. All right, Judy, you should be allowed to unmute now.
I was wondering with the Anthem Advantage care that retirees can sign up on, does that include the vision and dental care in the Advantage plan so that we don't have to buy the additional vision and dental?
So are you speaking of the Medicare Advantage plan that you're on over 65?
Well, I'm not on it yet, but
Okay.
yes, that I've been given the option to purchase.
Gotcha. Yeah, so with the Medicare Advantage, there's not any dental included under that. As far as vision, there is, you get one free eye exam under the Medicare Advantage plan. And then if you have any diagnoses or treatments or anything to treat eye diseases, then that will be under your medical. But the vision plan that we have separately, it's mostly for your annual visits and to get frames, contacts, and lenses.
Okay, so there is no dental.
There is no dental under the Medicare Advantage.
Okay. Thank you.
You're welcome. We have a few more.
Okay, the next one, Tyrone. Tyrone, you should now be allowed to unmute.
Thank you. I am out in the state, so I'm not eligible for the HMO option. I guess I'm disappointed that there is no choice. There is only the PPO. Is that due to there being a small percentage of the employees, a very small percentage of the employees under 65 out in the state? Is that why we don't have an option?
So the answer for this, unfortunately, is the RHP and EPO plans, which are eliminating this year, are not financially viable going forward. As part of the increasing healthcare costs rising across pretty much all of the nation, the RHP and the EPO plan just aren't financially viable going forward for those reasons, so they are being eliminated. It's not necessarily because the people who utilize them are in the minority, so to speak. We're getting rid of that, unfortunately, for employees as well. But it is as a result of those rising healthcare costs. Tyrone, is that all of your question?
Thank you.
All right, next, we have Karen. Karen, you should now be allowed to unmute.
Good morning, Coleman. I actually have a question for you. Either of you can answer. Joshua, you mentioned that there was a 10 county coverage area under the HMO. Can you please tell me what counties those are? That makes a big difference to us in our decision.
Yeah, for sure. Pull them up real quick. Okay, so those 10 counties, they're going to be Anderson, Bourbon, Clark, Fayette, Franklin County, Jessamine, Madison, Mercer, Scott, and Woodford counties.
Okay, that was 10. All right. My other question, because I have a lot of questions, I'm not going to take up time on this. on this workshop. When and where are the next in-person enrollment presentations?
Yeah, the open houses. Let me pull it up
Open
first real
houses,
quick.
thank you.
Yeah. I know we had one this morning.
Oh,
Yeah.
great. That's good to know.
So give me just a second here. There is another person asking about that in the chat. I am going to respond to that, and I believe everyone should be able to see that link as well. Joshua, do you have it on the screen there? It does not. Okay.
Let me pull
look-
up my
Yeah.
spreadsheet that I have the whole schedule here. We have some virtual open houses as well. Let's see where we
No,
at.
not virtual. I'm a
We
boomer.
have
I'm not doing
no worries.
virtual.
So we have so we had one at Eastern State this morning.
Don't
So
even
that
tell
one-
me that. I very well could have made that. It doesn't help me after the fact.
Now,
So
yeah.
when are the open houses moving forward in
Mhm.
person?
Yeah, so I just linked a copy of the web page where you can sign up for them there, or like find out the attendance sheet. We've got another one at Good Samaritan on May 5th, another one at Chandler on May 6th.
Time, May 5th at what time at Chandler?
It's at
Or at Sam?
Good Sam, May 5th, 7 to 10 a.m.
Thank you. And is there another?
Yes, there's multiple on there. Like I said, Chandler, May 6th, Peterson Service Building on May 7th. We do have a small one at Alumni Park Plaza on May 8th. Another one at Chandler on May 14th. And then another one on May 16th at Bosworth Hall, which is where Maine HR is located. And like
Okay.
I said, that is on our website.
Okay, can you
Which
send
should
me a
be-
link? Can you
It
show me
should be
something?
in the chat now. You can
All right,
also
I'll-
find this information on hr.uky.edu/OE.
Okay. It's still, it's concerning that we have to dig for this information. It's unnecessary. I'll get to one. Thank you.
All right, and I believe Judy has another question. You are now allowed to unmute.
Yes, I plan to retire on June 30th. Do I need to go through this open enrollment, or do I just fill out the form that the retiree, I think it was Terry Knatzer sent to me?
Have you spoken with someone at the retirement office?
Yes, and she
Okay.
sent me a form, but I
Yeah.
don't know if I need to fill out that form or if I need to do something online as a retiree.
Generally, I would recommend that you speak with your retirement officer, and they can go over the specifics of your situation. Generally, you wouldn't really need to participate in open enrollment this year, with a couple of exceptions. But I would speak with your retirement officer about that.
Okay, thank you.
Then we have another one from Gary. You're now allowed to unmute.
Can you hear me?
Yes, we can hear you.
All right, so my wife and I are well over 65.
Mhm.
And I'm wondering if you're going to have any either webinars or virtual open houses for persons who are on the Medicare Advantage plan in terms of changes or the ins and outs of those programs.
Yeah, so I believe United Healthcare will actually put some on, like some webinars kind of like this to go over the Medicare Advantage. Coleman, are we doing the retiree fair as well? Again
Yeah.
in like October?
Yes, I don't know if this is set in stone yet, but I believe there will be there will be a our usual retirement conference around around late to mid October, and then we'll have our normal retiree fair earlier on. I don't unfortunately have the date on that. I think it's late September for that. either the last week of September or the next to last week. I'm not 100% certain on that. But we have an open house for that as well. I will note too, there are no changes to the Medicare Advantage plan as a result of UK's open enrollment this year. So if you have the Medicare Advantage plan, there's nothing that you need to do right now. Your benefits are not changing. If anything is going to be changing, that would be announced during the Medicare open enrollment in the fall.
All right, and so you'll be sending those out, information about those things?
That is correct.
And
You
you'll probably,
mentioned something about, United Healthcare puts on, either webinars or, virtual events. News to me. I guess I don't watch, United Healthcare because usually those things haven't been all that helpful, but it sounds like it's something that I ought to be paying more attention to.
yeah, I think they send out some communication around the open enrollment about, I know they offered a couple webinars last year. There wasn't anything that changed last year. The premiums changed a little bit, but as far as the services, nothing changed. But they'll always send out something around that time. And if you receive it, feel free to reach out to us first, and we can, verify if it pertains to your plan or not. But yeah, I think this is something that is helpful to retirees, and I'll keep that in mind getting closer to our open enrollment. We can offer one that I could put on for similar to this, but just about Medicare Advantage.
All right. It can be confusing, these two different open enrollment periods.
Yeah, unfortunately, that is a result of UK going by our fiscal year, which is July to June, whereas Medicare, unfortunately, has to go by Medicare's open enrollment, which goes by the calendar year, January to December. Unfortunately, there's not a whole lot that we can do to change that.
Right. Well, for example, when you are working, you have access to the MetLife legal.
Mm-hmm.
And you still have access to it after you are retired, but you got to be much more careful about dealing directly with MetLife and keeping your premiums up because that does not come along with your open enrollment. In other words, you can deal with health insurance, with eye insurance and dental insurance, but you can't deal with the legal insurance via open enrollment. You have to deal directly, as far as I know, with MetLife.
That is correct. Mm-hmm.
It would be helpful if it was included in the open enrollment.
Yeah, generally, unfortunately for retirees, the voluntary benefits, you have to work directly with the vendors. It's not the same process as employees have.
Right. All righty.
Okay. And then Sherry, you are now allowed to unmute.
Good morning. Thank you all for this. I have one question. I have always had the EPO and I'm retired. So if I do nothing, will I automatically be enrolled in the PPO and will my vision and dental stay the same?
Yes. Now, I think I just responded to you for the public as well. But essentially, this is good for everyone to know. If you are in the RHP or EPO plans, you do need to enroll this year. Primarily, you will need to select a new health plan. Even if you're not eligible for the HMO, you will need to sign up for the PPO and submit a form for that. Dental and vision, while you are not required, just so there's no confusion, I would strongly suggest that you go ahead and reselect your same dental and vision plans on the form, just so that there's not any accidents and no confusion on what your coverage actually, which we're wanting for that.
All right, thank you so much.
Absolutely. There was another question here. If you want to retain dental and vision coverage, and you're not wanting to make any changes to those, dental and vision will automatically roll over into the new fiscal year.
And I do want to mention with, like you mentioned, Coleman, checking your dental and vision. If you know what you have, there is an option to put no changes. If you know you don't want to make no changes, that way, because it can be confusing. If you've had Delta Dental Enhanced for how many ever years and you just don't think about it and you put basic on the form, then either I enroll you into basic or I'm trying to reach out to make sure that change was correct. So if you know you do not want to make changes, there is a spot on the form where you can select no changes. But that is not required if you're on Medicare and you just want it to continue. You don't have to send anything in to us.
Gary has another question. You may unmute.
You're still muted, Gary. Oh,
All
there
right.
you go. There we go.
Last year, we did get a form. We didn't have to do anything, but we could send it back in if we wanted to. This year, I did not receive a form. This year, all I got was the packet with the plan information. So are we going to get another form or not?
Yeah, customer service just reached out yesterday and that we were notified that forms didn't go out with that packet. So they are resending forms to retirees. If for some reason you don't have it, feel free to just give us a call, reach out to us. We can definitely get that to you directly.
But as you say, is that we don't really have to fill out the form if we're not making a change. That's correct.
Mhm.
All right. Thank you.
All right. I believe Karen has another question. You may unmute.
Well, that was quite a delay. You just sent me the unmute option. Gary mentioned that he received a packet. I did not receive a packet or a mailing of any kind. I'm at the same address. What's up? Could somebody send me a packet? That would be helpful.
So unfortunately, the mail is not always super reliable. We just sent them out a couple weeks ago, so it may be lost in the mail. But I will make sure that a packet is sent to you as well, and I will make sure that a form is included as well, since they weren't included previously.
Okay, 2 weeks and I live in Lexington. Huh, yeah. Lost? Okay, please send me a packet.
Okay. All right. Linda, you may now unmute.
Yes, hi. Are there any resources out there that show comparisons? Like you said, our UK our deduct for an ED visit, it went from a copay and 10% to just a straight 30% co-insurance. That really isn't very helpful in giving us an estimate of anticipated cost. And is that cost based on your negotiated price or on hospital charges? Again, that could be pretty significantly different. I'm not sure how to plan for that.
Yeah, so unfortunately, we are not medical coders. You would probably ultimately need to talk to the carrier about, or to the provider about that, as far as what the cost on that would be.
But you understand what I mean? It's like
Mhm.
sometimes there's a negotiated price for the insurance company, but then other things are based on what the hospital charges are. And yeah, having worked in those things, it's like pretty significantly different because keep saying that the premiums and those things haven't changed. Not so some of these copays and co-insurances are really significant increases in the cost of insurance. It is a big difference.
Mhm.
So I'm a little frustrated that there's no way for us to figure out what those are. what they would be. It's just kind of like getting a surprise bill. It becomes a surprise bill. It's like, oh my God, $5,000 when last year I paid $1,000 copay. It's like pretty big difference.
Yeah, and do remember, of course, that there is the medical out-of-pocket maximum. So the most that you're going to pay for the PPO is $4,000 in the Anthem network. That is the most that you will pay for medical expenses. So
Yeah,
there
but that
is a
could be a
limit on
one
that.
time instead of all year. I never got there, and now
Yeah.
I'm gonna hit it the first time I have
Yeah.
a visit.
And what happens is once you hit that, it's covered for the remainder of the calendar year. It's not just a one time. So, for
Mhm.
example, let's say that you did have some sort of catastrophic accident and your bill was, your bill was, $100,000, right?
Mhm.
Once you hit that $4,000 mark that you've paid in medical expenses, everything for that bill and then anything further for the remainder of the calendar year is then covered at 100%.
Okay. Okay. Well, that helps a little bit then. It just, you know, I have to say it kind of grates sometimes when people say, well, there's not an increase. And then I look and see there are increases in copays, there are increases in co-insurances. It's like, premium's not going up, but cost sure has, you know. So, but okay. Well, thank you.
Sorry, Gary. Apologies, you don't have to unmute. Joshua, do we have a question here? If you are switching from the UK PPO to the Medicare Advantage plan, what is your advice on maintaining healthcare coverage given the different enrollment period?
Yeah, so it kind of depends on why you are changing. So are you asking on just how to make the change? Or so there's a couple of reasons why you would have to change. If you're over 65 and retiring, you would not be eligible for the UK plans anymore and have to go to Medicare. Retirement officers would help you with that transition. If you are currently under 65 and not working, and you are turning 65, say in August or something, your enrollment period with Medicare will be 3 months before your 65th birthday. And we will also send a UK packet about the Medicare Advantage and enrollment 2 months before that. So you should receive things from us and probably Social Security about enrolling in Medicare. If it's outside of open enrollment, once you're Medicare eligible, that's a qualifying event to drop the UK plan and sign up for Medicare.
Okay, Karen, you have another question. You may unmute.
Yes, regarding the lady whose name I didn't catch, asking the question about the 30% charge.
Mm-hmm.
I don't know if I missed it or if you just didn't answer her question.
Mm-hmm.
Is the 30% based on the negotiated bill or the original charges? Like she
Unfortunately,
said, that's
that would
a huge difference.
unfortunately be a question for Anthem. We don't have that information on hand, unfortunately.
Well, we need that type of answer. We need that kind of guidance to make our decision.
Yeah,
So,
unfortunately,
something we-
yeah,
I
go
mean,
ahead.
we can reach out and see if we can get some, maybe a specific example of one. And when we follow up, we can try to follow up with something more specific. Because I think it just depends on the service and how they bill that actual service. So it could vary depending on who you see.
okay, we need to know. We need a better idea here. Please. Thank you. You'll address that in a future webinar. Hopefully before open enrollment ends.
Yeah, I'll see if we can send something out to you as well once we have some sort of information.
Well, what about the other lady? What about everybody else out there that needs this information?
Yeah, if you have any questions about that, you can always contact our office, and we can send that out to you directly.
Okay.
Yeah, that's not what you need to do. It needs to be across the board. Everyone needs to be able to make an informed decision. That's it.
All right, anyone else have any other questions? Linda, you may now unmute.
Okay, let's see. I was trying to find my unmute here. Can you hear me?
We
Yes,
can
we
hear
can
you.
hear you.
Okay. If you need to change, I currently work steps 0.2,
Mhm.
and if you need to change before the Medicare enrollment, say I should drop below 0.2, how is that handled?
Yeah, so I basically run a report every month to check our working retirees and direct bill. So I definitely recognize your name. I see it on my reports every month.
No, good, good. I'm
Yeah,
glad.
so if you were to drop below 0.2, say steps entered in action, a change in status and put you to 0.10, I would basically reach out. We could extend your current UK for 60 days. I would reach out with the forms and the information to get enrolled in Medicare. So that would be also a qualifying event. You don't have to wait for open enrollment to do that. I would
So
reach out about your
basically,
eligibility.
I'm fine if I don't hear from you. Is that what you're telling me?
Right. Yeah. So I run a report every month. I look all the working retirees up just to check for any kind of change in status. But if there aren't, I usually send out a letter. I will check for working retirees' emails. And I'll keep a watch on it. If I don't hear anything back, if we send letters and things about eligibility, I'll start trying to call and things as well.
Okay.
Change in status is a qualifying event, so it's not usually an issue to get you switched over in those cases. So you would be fine. If you do know that your position is going to be changing to below 0.2 FTE, you can always proactively reach out to us, and we can start that process a little bit earlier.
Okay. Mine isn't. It was just I thought, well, I don't really keep track of if I'm doing that every month or not. I kind of go along. Sometimes I'm more and sometimes I'm less. So
Yeah, and there's some like department communication that we have. I kind of just go by what steps communicates with us as far as entering that action. So if you have like any big change or change in your hours or anything, I always recommend reaching out to your supervisor or steps so they can evaluate your FTE or evaluate your working hours. Because we kind of base it on what they actually enter and tell us as far as like your status.
Question to go with that is I cover my husband who is also over 65. And so is it correct that he still has to stay on the same plan that I am on? He can't be on UK Advantage and me on PPO. Is that correct?
Yeah, so your eligibility drives your dependent's eligibility.
Okay.
So if you're not eligible for Medicare, then he's not. So but if it's the other way around, you're on Medicare and only eligible for Medicare and they're under 65, then that's when we would do a split plan.
Okay. Okay. Well, thank you.
Mm-hmm. You're welcome.
Okay, there was one other person had suggested this. Again, nothing is changing with the Medicare Advantage plan this calendar year. As always, your Medicare Advantage plan has a $185 deductible and pretty much a 4% coinsurance after that. And then your rate, will remain the same for 2025, depending on your age and years of service and your hire date. In other words, if you have the Medicare Advantage plan, nothing is going to be changing that during UK's open enrollment and will remain the same through December of 25. If there are going to be any changes, then that would be announced during Medicare's open enrollment in the fall. Any other questions?
And I've made some notes, and Coleman, we can maybe work together a little bit to put together like a FAQ for this specific webinar. We have a list of everybody that attended. You know, we can see if we can send out communication to those emails that you registered with. Just that way it's a good follow-up to the questions that everybody asked.
All right. If there are no other questions, then I believe that is all that we have for today. Thank you for attending. Of course, if you have any questions, feel free to reach out to us either at retirement@uky.edu or at benefits@uky.edu. Thank you all and have a great day.
Thank you all. Have a good day.